or Assembly Member Kevin McCarty for the 7th Assembly District here in the capital city. My district includes the city of Sacramento, the majority of the city of Sacramento, a little bit of the unincorporated part of Sacramento County, which is Antelope, Rio Linda, Roseville, Rosemont, not Rosemont, excuse me, Rio Linda, Antelope, North Highlands, a teeny bit of the unincorporated area, the Oak Park area of South Sacramento, and the entire part of the city of West Sacramento. And it's my pleasure to be talking to you once again about COVID-19, what's happening with our community, with our state. There are way more questions and answers at this point, as I will readily admit. But that's what we're going to try to get to today. Really, the topic of the day is reopening California. We're starting this phase 2 that the governor announced a few days ago, and the guidelines came out in the past 2 days. And what does that mean in plain English for you and I, for people in our community? We want to get to that today over the next hour. We have a number of questions that have been presented to us before. We'll get to those, as well as people are asking questions as we go right now. So with me today, I'm pleased to be joined by Dr. Peter Bielenson. He's the Sacramento County Director of the Health Services Department. So he's been doing a fine job, a great job here in our capital city, and also really working at the state level. So he's talking about Sacramento, but he can really talk about what's happening in California with the stay-at-home orders and the restrictions and how we're lifting some of those elements. So first, maybe allow me to have you further introduce yourself, Dr. Bielenson, and give us a snapshot of what you do and what you've been working on here in Sacramento County.
Sure. Thank you very much, Mr. Assemblyman. This is a pleasure to be here. I've been in Sacramento for 2 years, plus about 10. I was here for 10 years when I was a little kid, between 6 and 16, and was gone for about 35 or 40 years and came back as Director of Health Services. So I oversee behavioral health, mental health services, jail health, emergency medical services in some regard, and then primary care, including the Sacramento County Health Center at Stockton and Broadway, and of course, public health as well.
Okay. And so let's get right to it. So the first question we want to talk to you out of the gate before we get to some of the questions from my constituents is what are some of the restrictions that have been lifted for residents under the new Sacramento County public health order? The one that we came out with last week.
The public health order, which came out May 1st, allows for a few things, including elective procedures and elective visits to doctors and to dentists. It allows for some more outdoor recreational ability, like tennis and things like that. And it allows for real estate to be done with someone who's still living in the house, and allows for food trucks, among other things. So it's a modest increase in the decrease in the restrictions. Stay-at-home order is still in effect, however. Then the governor came out. I think you want me to talk about the governor's thing yesterday?
Yes.
The governor came out with criteria yesterday that he wants counties to attest that they meet. And these are all the kind of basic things you would expect, like rates of cases in a county, the number of deaths, the number of people that you can homeless people that you can take care of if they test positive, et cetera. We meet all those criteria except for one, which is the deaths in a 2-week period. You're not allowed to have more than a single death in a 2-week period, which is difficult for any large jurisdiction to meet. Particularly because Sacramento County ranks number 1 in the entire United States among the 53 largest metro areas, and the lowest case rate and 5th lowest death rate among all the urban areas. So if Sacramento can't meet it, most of the jurisdictions can't meet it as well, the big jurisdictions. And the governor's guidelines, the governor is allowing a few new things starting today, including curbside pickup for retailers like clothing stores, booksellers, sporting goods stores, et cetera, and florists.
Yeah, so that leads to my first question. This is a question from Rachel, and she asks that with regards to phase 2, it doesn't really mean much. Everyone's been doing curbside pickup all along. So what's really new for the people of Sacramento and the region?
So what is actually really new is we were just on a call with the state, and it is potential that we will be able to go ahead and open up more broadly than we currently are, or than the governor currently allows. And so we'll have more to say on that next week.
Okay, the next question is from Richard, and the question is, why hasn't Sac County required residents to wear masks while in public? I know the mayor of Sacramento, who of course is not our public health official, but he is our leader of our city. He put his opinion out there that he's saying that he thinks we should, but why is that not a requirement right now for the people of Sacramento?
So it's been a strong recommendation since the CDC came out with that probably weeks ago when I came out for the strong recommendation at the time. The reason we didn't require it was predominantly because there weren't adequate numbers of these masks available at the time. They are much more readily available now, as are face coverings, since people can make these face coverings with bandanas and coffee filters in between them, etc. And so in our next order that'll be out in the next week or so, we will come out with more guidance on masks. It will be more widespread use of masks, but not requiring them in every aspect of the world.
Gotcha. So I have a follow-up question here on masks. This is from a resident. Let's see, Deborah. She's saying, are there exceptions? Well, granted, right now it's just a recommendation, but even across California, where they do have some of the communities where they have mask requirements, are there exceptions for people that have panic attacks, allergy problems, anxiety, and so forth, from wearing a mask?
Yes, and asthma and chronic and emphysema and running, and people who are running or bicycling, et cetera. So that's why I'm saying we're not going to come out with a one-size-fits-all mask policy. We're going to come out with a more nuanced one, but it will be recommended in many circumstances.
Yeah, I know that this week when I was in my committee hearing at the Capitol, we had the masks on. We walked in the committee room and interacting with people walking to the Capitol. But once you're talking and engaging, you know, I was having shortness of breath. I felt like I was literally going to pass out. So I had to take that mask off when I was presenting. And so the mask does have some other complications as well.
Right.
Okay. I have a question from Diana. She's asked, is it safe to travel across county lines?
So it is safe. It's safe to cross county lines, particularly if you stay in the same car, and particularly if you don't go into a store where there's a gathering. So, for example, let's say you're going to visit a relative in Napa County, and you just drive there. That should be fine, assuming that the individual has quarantined or is safe as well. But I wouldn't drive to Santa Clara and go to a huge outdoor flea market, for example. That's not particularly safe.
There we go. Yes. Here's just a general question on just the public health response. What's happening with our hospitals in Sacramento? Are they overcrowded or are they vacant?
They're literally close, not vacant, but they're very under capacity, which is one reason to allow the elective procedures back into the hospitals and into the medical centers, because with elective procedures were stopped, and so people were not doing the, whatever, the hip replacements or whatever the elective procedures were necessary. And we have so few COVID patients, which I'll get to in a second, in Sacramento County, that we had a tremendous amount of surge capacity, a capacity to be able to meet a surge should it occur, and it has not occurred as of yet. So, for example, right now, we are at the lowest level in 5 weeks of hospitalizations and ICUs. We have a total of 43 people total in all of the county hospitals across the board in our 1.5 million people. There are only 43 people who are COVID positive, who are in the hospital for COVID complications. 16 of them in an ICU and 27 in a regular hospital room. So we have plenty of room to deal with any kind of surge should it occur.
Okay. We will have a lot of questions on reopening, but right now we want to focus on some of these public health questions. We're going to focus on masks and testing a little bit. So a few more things about the masks. Michael asked here, what are the medical and statistical documentation that justify the requirement to wear a mask? Granted, we're not requiring it here in Sacramento, we're recommending it, but is there any evidence in some of the other jurisdictions that it has a value and it really can truly impact public health?
So there's no real good evidence from other counties doing this, partly because they've just been doing it for a short period of time. The evidence from national statistics is that it makes a modest amount. It's partly reassurance that if you see someone walking towards you with a mask and you have a mask, you feel more reassured. But there is some information that at least for people who have the virus and are wearing a mask, it keeps them from spreading it as much as they would if they were breathing without one. So I think it makes sense in general to have masks.
Yeah. Okay, let's get to testing right now. So I was tested 2 weeks ago. Members of the legislature, as we go back, we were asked by the county, which is part of your work, to have us tested. Many of us come from areas across California. Of course, I'm here in Sacramento, but most of my colleagues are from LA, the Bay Area, San Diego, far from Sacramento. So when I got tested, we had two tests. One, the diagnostic, do you have it? And then number two, have you had it? And so can you talk about what those two tests are, how people get them, what's going on with testing for the public in our community?
Right. So there's a huge amount more testing going on now than was going on just a few weeks ago. Excuse me. When we started about maybe 2.5 months ago, there were 20 tests of people per day in the public health lab, and that was it. We had a woefully inadequate amount of testing. That has gradually come on board until within the last week or two now, we've had massive amount more testing, not as much as we would hope for, but significantly more than we had before. So for example, we have 100 kits that are looked at, 100 lab tests that are read at the public health lab every day. There are 200 to 300 doctors who prescribe tests for their patients. We have about 300 to 390 people coming through the drive-through in Cal Expo now a day. And we are testing people in nursing homes, assisted living sites, behavioral health congregate sites. We've tested all the homeless in shelters. So that's 1,000, we've well over a few thousand people that have been tested now. And for the first time, we're also starting this week to test people who are asymptomatic or who don't have symptoms. That's for two reasons. Number one, to be able to tell people if they have the disease, if they're curious or whatever. And number two, to identify people who are asymptomatic, and there are about 25 to 40% of those with the virus who are asymptomatic, who don't have symptoms, but are spreading the disease, are contagious even still. And so we want to identify them so we can contact trace. We can trace their contacts and test those folks as well. So there's a lot more viral testing going on. The virus test is done by a swab, at least right now, by a swab in the nose that goes to the back of the throat. It's called a nasopharyngeal swab. It's not the most comfortable thing, but it's not horrific. And it's an RNA test, a test for the RNA of the virus. So we can find if you actually have the virus present. The antibody tests are a separate, and the viral tests are pretty good now. They're pretty effective and pretty well validated. The antibody tests are what I've been calling the Wild West of testing, where because it's under an emergency use authorization for the FDA, the Federal Drug Administration, the Food and Drug Administration, anybody can, not anybody, but a lot of people can come out with tests. There've been a lot of finger prick tests for antibodies, which have proven to be completely worthless. And so countries and states, et cetera, have lost a lot of money on it. The test that appears to be best for antibodies is a blood test. And antibodies show whether or not you've been infected with the virus before, at any given time before. If you've been exposed before, and you are in convalescence. The problem with the antibody test so far is that only 70 to 80% of people who had the virus and have recovered from it actually develop antibodies on the test, and we're not sure how much immunity it confers. So normally, if you have like a flu vaccine, we know at the beginning of the year it's about 50 to 65% effective. It also reduces the severity of the disease, and we know it lasts for several months. We don't know that right now obviously we don't have a vaccine, but we don't know that right now with this virus.
Gotcha. Let me ask about the other places. So can you just repeat that once again, as far as where the public can go to get tested and what are the new requirements? to get tested?
Yes, so they can go to their own doctor if they want, and many doctors will order the test. They can go to the Verily Sacramento County Public Health drive-through in Cal Expo and go on the Verily website, VERILY website, and they can sign up for an appointment that way. And that includes asymptomatic people without symptoms as well as those with symptoms. This is the first week that's been true. And then we're just launching a new community-based walk-up clinics at La Familia, St. Mark's in Oak Park, actually, in your district, I think, and at Roberts Center on Norwood in Del Paso Heights. Those are our first 3 community-based sites. We're also going to do a couple at Asian Pacific Islander communities and a couple more or one more in the Hispanic community as well. And those will be for people who are who have symptoms and don't have symptoms alike. And it'll be a walk up, but we will want people to make reservations by either phone or computer.
Okay.
And those will start late next week, early the following week.
Alrighty. Let's go back to the masks. Somebody asked this too. What would you recommend for someone to purchase masks in Sacramento County just for public use?
So one thing we want,
go ahead.
Right. So we want to make sure that you don't take up N95 masks. N95 masks are the big masks that are specifically fitted to your face. And those are really, we want to reserve them for healthcare workers, transit workers, other people who really need these masks. The mask we're recommending is paper masks, which look like the surgical masks, those little blue. Actually, where's mine? It's not in here right now. I have a bunch of them. A surgical mask, of which there is pretty good availability now, or any other face wrap with like the bandanas that you put a coffee filter in between the layers of, and you put it together, put 2 rubber bands on the end, and you can make it into quite an effective mask. So those you can actually make yourself, and there are people selling them all over on the street as well. But again, in answer to your original question, the efficacy of them is modest, probably better than not, but it's not going to necessarily prevent you from getting the disease, although it does decrease it.
Okay. Let's get now to the reopening California questions. And I see a bunch over here on the screen too, but we have some that were submitted to us beforehand. So Javier asked, will reopening California still require those over 65 and with underlying health conditions to shelter in place?
Yes, so it's going to be there's going to be a phased in, California will reopen in phases, and the phases will differ in the regions of the state as well, with the rural north potentially moving faster than some of the suburban and urban central and Bay Area and Southern California. That being said, one of the consistent recommendations across the board is going to be for seniors, particularly those with underlying health conditions, to at least stay at home as much as possible. It may not be like a requirement, but it'll be a very strong recommendation that they should only go out for really essential activities as well.
Okay. Next question is from Judy. She asked, will Sacramento County allow pet groomers and stylists? I assume she means pet stylists or hairstylists?
Yes, pet stylists. This is a big.
Okay, we'll come back to hairstylists and barbers in a bit. So let's focus on pets right now. Will Sac County allow pet groomers and pet stylists to reopen today, May the 8th?
Okay, so not then, but we actually, I'm almost positive we've been allowing them to date. So what the Pet Stylists Do, and I'm very well aware of this because I've gotten a lot of letters from folks. And by the way, parenthetically, I've gotten unbelievable amounts of letters and emails about all these different things. So at least I kind of know what we're talking about in all of them. Anyway, the Pet Stylists, the way that works is the the pet owner comes to the stylist's lawn or yard, comes into the fence, puts the dog down, leaves. The stylist comes out, gets it, and does the styling, and then reverse to when the dog is picked or the cat is picked up. So as long as you do it in that fashion, we've been deeming that that's okay.
Okay, we talked just a second ago about stylists and potentially hair, so let's get to that. So barbers and hairstylists, what's the timeline for reopening those establishments?
So that's going to be a third phase, because that's, as by definition, face to face. Right, you're going to be, even if you're both wearing masks, well, it's obviously going to be hard to wear a mask if you're getting some types of shaved, or some type, like for you, if you're having your beard shaved, it'll be obviously hard to have a mask on. For me, I have very little hair. It probably doesn't matter one way or the other. But even with the barber or the hairstylist having a mask on, you're going to be face to face and up close. So that's going to be a third phase, almost for sure.
Okay, someone did ask me, where am I getting my haircut? Ryan, Joe. So my kids are helping me out.
My wife has done mine.
Yeah, there we go. Kids love that. So let's get on to another question. This is a question that, frankly, I have as well with my little kids, and one's right here next to me. Yes, those are my car keys. So the real world's going on right now. So the question is from a mom here about youth sports. She says, when will youth sports be able to resume? She wants to know specifically about her 11-year-old and her softball team. I ironically have two 11-year-olds that play softball. So Shannon Whitford has the question, but frankly, it's my same question as well. So what do we think about youth sport?
Yeah, so that's an issue because it's gathering of people. Obviously, a smaller number of people are gathering than at a Republic game or a River Cats or a Kings game, obviously. But because it's going to be hard, it's particularly for soccer, baseball to some extent. I mean, even if you had them staying outside the dugout, kids are just going to naturally coalesce together. And although kids are less at risk for severe disease, they actually seem to get the disease almost as much as adults, but are much less risk for severe disease. Nonetheless, they can be carriers asymptomatically. And so it's just long answer short, or whatever the word is, probably a third phase as well. It's difficult to do spatial distancing.
Okay, so that's another question we have here from Deborah. She asks, what will phase 3 look like, and when do we anticipate phase 3 to come to Sacramento and to California?
So, and I'll finish talking about phase 2 after this, but phase 3 is, it's not like magic. It's things that are more likely like small gathering places, schools. There'll be a lot of cohorting for schools where in order to not have as many kids in a room at one time as there may otherwise have been, you may have 2 different cohorts so that some kids come Monday and Wednesday, other kids come Tuesday and Thursday. We're working on that recommendation for the Sacramento County Office of Education, among other things. These small gatherings, small church gatherings in addition, for example, like prayer meetings that are with 10 people, those may be in the third phase. The fourth phase is pretty clear, will be the large gatherings of large fairs like the Cal Expos of the world, the metal, whatever it's called, Metallica, whatever the metal band thing is at Discovery Park that has tens of thousands of people.
Aftershock.
What?
Aftershock.
Aftershock.
I'm trying to score some points with my viewers out there.
Yeah, clearly I don't have that. So things like that, as well as like 49ers games and stuff like that, are clearly going to be the fourth phase. And I actually don't anticipate them potentially until we have a vaccine. Okay.
We have a question from Nick here. Nick wants to know about tattoo studios, and when can studios like, I'm not sure if it's his or hers, but when can Nick's studio reopen?
Okay, so we've been getting a lot. They have been, no offense to Nick, but they have been bad actors during this, in that there are a lot of tattoo stores that have kind of quietly, surreptitiously set up shop when they've been banned. So that's just an aside. But again, it's related to how how they can socially distance, and it's very difficult. Not that I have a pet tattoo, but it's very difficult from what I know to do a tattoo without being close to the individual involved. I mean, you're not going to have a stick out and doing the tattoo on someone. You've got to actually, use your hands and be in close contact. So I would imagine they'll be the third phase.
Okay. Wow, we're getting a lot of good questions here. I'm trying to keep up. So thank you all for participating, and we can't ask them all, but I'll try to summarize and get some of them in here. And yes, someone asked about a transcript, and this will be on our Facebook page to go back and review it again. And if there's any links or anything, we will keep them up here. Let's see. Let's get to this question here about, I want to talk about childcare facilities and then gyms. So let's first talk about childcare facilities and when are they going to reopen for working parents. So part of this phase 2 is people can go back to work in some type of office environments. And, like you just saw, I'm working today with you, and my kids are coming in here and looking for my car keys and interrupting. And so, look, I'm not alone. Every family out there is dealing with the same thing. So if some of these parents are going to try to get back to work, how are we going to deal with our child care centers that are not open to serve their needs?
Right. So phase 2A, if you will, this sort of soft opening that, as we were talking about with the retailers on the curbside deliveries, that is going forward now. Most of the other counties probably will not be doing the workplace opening for another few weeks, and so that they're going to continue to do telework majority. But your point is very well taken. Certainly by the second phase of part 2. There's a thing written on there. Sorry. But part of phase 2, when people do go back to work, we're going to need to open up daycare sites more than we currently have them. They are available now for people who are essential workers. And so there is some setup, there is some protocol as to how daycares are set up in terms of rooms, in terms of the common teacher, et cetera. So we'll probably build off of that.
Okay, now what about some of these child care centers, if you have some of their smaller ratios? I guess this is not really a question for you, but for us, is how do they pencil out? You have to pay the same staff, the same rent, you're serving fewer kids. And so if you can barely make ends meet, pay your staff a livable wage, how's that going to work if you have your kids are cut in half, but you're getting income?
That's a problem, and that's part of the economic dislocation of everything that's going on now that we could talk about, but it's not like my area of expertise, other than to know that we're very attuned to the fact that there's a lot of economic dislocation going on, and it's very, very difficult for people from a mental health standpoint, as well as a physical health standpoint, as well as obviously an economic standpoint, but that's an issue.
Okay, this is a question for a few people asked about the next phase, whether it's 3 in California or just the next update for Sacramento County. I read here somewhere that we're thinking May 22nd is when this order is in effect until. So do we anticipate having new rules for Sacramento County and potentially the state on May 22nd?
Yes, I think we'll have it before May 22nd. I can't guarantee it or say a specific date, but I think late next week, early the following week, we'll have an updated order because things are changing relatively rapidly. Okay,
I want to get to the gym question in a second, but this is kind of an offshoot of the gym question, and someone's asking here about photography services. So if it's a gym, like an outdoor yoga class where there's 5 or 10 people, or right here, professional photography where they shoot stuff outdoors, are those able to start now? Can people do that? Go to local park and do a yoga in the park with 10 people?
So we
if they keep their distance, can they go and do a photo shoot?
Yeah, under our order, there's no gathering of people outside of the family constellation. However, in our public health, people may attack me for this. But if there are 6 people, they want to do an outdoor exercise, they set their mats 10 feet apart, they don't use a gym shower, they don't go anywhere together, they just appear, do their thing, and leave. Honestly, from a public health standpoint, that's probably fine. and they're not going to get prosecuted or in trouble for doing that. Photography, similar thing. I actually have had I've had all these questions asked of me. So let's say a photographer is going to take a family photo. The family can be more than 6 feet away from them. He or she can take the pictures, and the family can leave, and they can leave, and hopefully that she would wear a mask, or he, or whatever, the photographer would wear a mask. So again, these are kind of nuanced questions. Some of it's common sense. Use your common sense. The main thing is social distancing, masks, and social distancing, and washing your hands.
Okay, here's a question about somebody living in a over 55 community with a swimming pool, and I've heard this a lot. When can that pool be used? Or conversely, some people, kids around neighborhoods, maybe they don't want to have them interact and play, but can kids get in swimming pools together? Not 20 kids, but a couple neighborhood kids.
So the neighboring kids is more of an issue, at least right now. The adults, particularly over 55, who want to do like lap swimming, if you're between laps, like if you have someone in lap 1, 3, 5, and 7, that's good distancing. And again, as long as you don't use the bathrooms or the showers, etc., you just come. There are a few private swimming clubs and private swimming places that have asked that question. Again, if it's common sense, it seems to make sense. You have social distancing. Obviously, you're not wearing a mask, but you have 10 feet between yourselves, and there's no one using other facilities, and they're not exchanging money or anything like that in terms of getting stuff on their hands. It's probably okay.
So what about neighbors? If they want to invite the kids from next door to come swimming, let's say there's a couple kids and they want to invite 1 or 2 other kids, and those kids are going to social distance within the pool and be responsible. Is that okay? Or is that it's going to
be very difficult to socially distance them, frankly, depending on the age. But there's one way that you could do this, and that is if you're doing the stay-at-home order anyway, which basically everybody's doing, and you quarantine for a couple weeks, then you can assume that both families are negative, if you will, and can potentially kind of have a conjoint swimming event.
Yeah.
But again, these are kind of one-off, or they're questions that are difficult to fit into the specific order that we have out. But if people use their common sense and socially distance, which I keep saying 7 times over because that's the key, then that will probably end up being a healthy thing.
Yeah, I'm asking this because we're getting a lot of questions over here. One question is just the question, I've heard this over and over, is what about chlorine? Won't chlorine kill the virus if there's a droplet floating in the air?
Yes, it will. It will, but like if you're swimming and you breathe out, and doing freestyle, you're going to aerosolize a lot of stuff from your breath before it hits the pool. So that's a good question, but it still could be dangerous. That's why we say significant social distancing.
Okay, I want to get to in a few seconds restaurants, but before that, let's talk about gyms for a bit. I have a lot of questions over here, and some of these gyms I know they've reached out to you and to me as an assembly member, and talking about if they have new standards in place and separation and distancing. What do we think as far as opening up gyms in a safe manner?
So indoor gyms, as opposed to these outdoor, potentially on a yoga mat type thing, indoor gyms are a little bit more difficult. They're going to be probably a phase 3 or a late second phase, because even though you can clean off you can do a decent job of cleaning off the mechanisms, whatever they're called, the gym equipment. It's going to be hard. Yeah. There's going to be a lot of people sweating and a lot of people coughing, and so it's a little bit harder. It's relatively easy to socially distance in those places, but it's going to be it's going to be potentially have more virus around than you would potentially want. initially. So there have to be very good cleaning. The staff has to wear masks, and you have to socially distance at the very least. But I think it's a late second phase, early third phase.
Early third phase.
Yeah.
Yeah. So that is weeks away, months away.
Yes. Probably a couple months away.
Couple months away. So for gym operators, there's no real good answer for you right now.
I mean, that's just my guess right now, my educated guess.
Okay. What
on the other
do
hand,
we have?
restaurants.
Go ahead. On the other hand,
restaurants.
Restaurants, yeah. Let's talk about restaurants for a while. Food. Everyone loves food.
So
let's talk about.
So restaurants are much more likely. They're going to be probably allowed in some of these early phase 2 in the rural counties. And we would like to do this here in Sacramento County on the relatively early side as well. Restaurants are kind of a good example of how you can adapt something to these weird times. And so for restaurants, there'd be things like I'm not guaranteeing this, but it would be restrictions like 33 to 50% smaller tables. Fewer tables in the restaurant. The staff and the cooks would wear masks, potentially gloves, although actually gloves, if you use it from person to person, unless you change it each time, which is going to be kind of difficult when you're serving other people. You may actually prefer to have people wash their hands very carefully. Disposable menus, so instead of the same plastic menu that everybody's touching, you'd have a paper menu that would be thrown away after every visit, and potentially a symptom check at the door, maybe with a thermometer, maybe with just asking questions. And then also to allow restaurateurs to have more capacity, there are things that we could be looking at, like I know you are looking at in Sacramento, where the city would allow sort of some variances and allow outdoor dining as well, to expand the amount of dining that could be done in the place. That doesn't just have to be indoors, because of course Sacramento doesn't have any rain for the next 6 months basically, and so you could have an outdoor site as well. So that's an example of something that can be adapted fairly well to these odd times, and would be one of the first things to be opened.
Yeah, and the question there, it's not really a public health question, but it's just an economic question. Some of these restaurants, to pay their wait staff, their insurance, workers' comp costs, their rent, all the other stuff, they need to be at capacity. So if they're opening it up and only having 30% of their tables being utilized, how does that pencil out mathematically? I don't know. So I think
that's why we want to have more. That's why we want to have more outdoor ability and have tables as well. You may need variants.
And what is outdoor? Why does it make a difference?
So like let's say if it's a restaurant, I don't know, I'm making this up, on 40th Street or whatever, and there's only room inside the building to have tables. But if you're on K Street, let's say, you can come out onto the pavement, or further onto the pavement than you would otherwise by a variance. That would allow you to have more tables outside than you may not have even been able to have tables outside before. So just looking at things, I'm not giving specific example. I don't mean to give specific examples, but just looking at potential options to open things up a little bit more is a possibility.
Yeah. Okay. What about, I've been asked this, not of course like a nightclub and bar, but like these craft beer facilities, these outdoor breweries where they're outside, they're open. Sometimes I've been there, it's super, super packed, but could those open up but have a limited capacity as far as people getting in?
Yeah, so I think that's a late second phase thing. In fact, I think the governor actually talked about some aspect of that in his discussion about the last week or so. That may be an option for some of the rural counties now to open up. But I think that's in the second phase.
Okay. Let's see. Question about hotels.
Yeah. So
what about hotels?
So hotels are actually make good sense. Again, as long as you have really good disinfecting and cleaning, which they hopefully will be doing. Obviously, with someone staying in the room, as long as they're the same family, or people who normally live together, staying in the room is actually one of the safer things that could be done. As opposed, obviously, you wouldn't want to have conventions or meetings allowed to go on. That would be gatherings of people that would obviously be not allowed. But certainly, in individual rooms and staying in the rooms individually is something that should be happening probably in the second phase, relatively early.
Okay. What about question here for typical government business at courthouses and state buildings and county offices, your own county health services department? When do you expect those to get back to normal?
So obviously they're still operating, a lot of them. I just came from our public health staff meeting in our building on Florin Road. So some of them are still open. I get a lot of calls from courts, from the state courts and the federal courts, about what they can do to make adaptations that would fit their clientele. So there's a whole range of things that can happen, from everything as interesting and small as a whisper pickup machine that allows defendants to whisper to the defense lawyer without getting up close to them, which I thought was kind of interesting. They also are doing a lot of disinfecting. They're also testing. They're testing and quarantining people if they end up having symptoms, just like you would anywhere else. So there are a lot of aspects that could be brought to bear on the courts and the government buildings, and I think they'll open in the late second phase, again, as part of the typical offices opening up to some extent. It may help to do what second phase, third phase, and fourth phase timing is, if I just may for a second.
Yeah.
So the second phase, the early phase, we're actually in now, at least in the rural counties, with the governor's criteria that will allow things to open up, including like restaurants, et cetera, et cetera. Those types of things would happen in larger counties, assuming that we're allowed to go ahead, even if we miss one of the criteria for the governor. So that'll be in the next 3 weeks, would be phase 2A. Phase 2B, the more difficult things to do, if you will, like potentially gyms, like pools and things like that, would be in the next month to 2 months. Phase 3, which would be maybe the small gatherings like prayer gatherings, things like that, I would think would be in the next few months. And then phase 4, which are the large scale gatherings that we were talking about, the stadiums, the aftershock, et cetera, those would be probably late winter time, or in the winter this coming winter, or as long as it takes to get a vaccine potentially. So that's sort of the timeline that I should probably wade in with.
Yeah. Well, speaking of that, I see some of the questions here, and I hear them too. A lot of frustration. I've seen protests at the Capitol. Some are more responsible than others. I'll note that. We've had numbers decrease. The infection numbers are there. They are. The mortality. Where someone says here, latest data shows infection rate high, but low mortality rate no worse than seasonal flu. Sacramento has the lowest numbers. Our economy is in a tailspin. Restaurants are closing down for good. The mall at Nordstrom at Arden Fair going out of business after 30 years. Some of these gyms may not be able to hang on that long. So what do you say to that? I know you're the health guy, not the economic guy for Sacramento, but what do you say to that we're not doing that bad? No one's in the hospital. The death rates have plateaued. So why aren't we reopening the economy? We're going to kill the economy forever and have more unemployment, more hunger, more other problems. So I'm just kind of paraphrasing what I'm seeing over here, and I want you to address that.
Right. So Ryan Quist is our behavioral health director. I think you know him. Has been speaking about the massive effects on mental health from this economic dislocation and the general milieu in which we're living now, which was, staying isolating, et cetera, et cetera. I am extremely aware of the economic issues and realize how lucky that I am that I actually have a job to still be working at every day from home. So the point is extremely well taken, and it's a difficult balancing mechanism. So if you were talking to people, and I'll get back to this in a second, the California part, but if you're talking to people in New York, in Boston, in Cambridge, in Philadelphia, in Hartford, docs there, nurses there, healthcare workers there, transit workers there, they would say, are you guys out of your mind? Why would you open things more widely? Look at what's happened here with thousands of deaths and hundreds of thousands, literally hundreds of thousands of cases. Now you can say, well, that's New York, and New York is more dense. There's no question that those cities are denser cities. But if we had a conflagration that started in the homeless community or in a church community, let's say, or in a long-term care facility, for example, it can quickly get out of hand, and then you end up with surge affecting your hospitals and a disaster on your hands. So you got to kind of balance both. And that's why we're trying. I think the governor's guidelines are a little bit slow, but good, in that he's reopening it in phases, which makes great sense. That's great sense. But in phases, and so that you can pull back if you need to, if you see the data going out of control versus not. And it's a question of how fast to move. And I think you could argue we should move a little bit quicker than we're moving now, which we may be able to do in the next week or two. But there's no 2020 there's no 2020 foresight. So we're doing the best that we can. It's the best answer I can give.
Okay. We had a few inquiries here about where can this information be found afterwards, the video of this. So we will put it up on our Facebook page, Assembly Member Kevin McCarty Facebook page, as well as people have asked where are some of the links on what you're talking about. What is this phase 2 order with the next stages? So we'll put up all these on my Facebook page, which all of you are on right now. So I want to address that. Okay, we have about 15 more minutes. Let's get to some of these other questions here. Question here about senior facilities. What phase would senior facilities be in? Question from Janet.
That's a huge issue, and one that we're jumping on here. We had not been testing the senior centers in general, but it is clearly the guidance now of the CDC. It is required by several states, and we are actively pursuing that. We've been doing that now for quite a while, that we are testing all assisted living and long-term care facilities with at least one case in the staff or a patient. And we're finding, usually we're finding more and more cases in those places. That's the bad news. The good news is actually that a large number of these, not all of them by any means, but a significant number of these senior citizens are actually having relatively mild health conditions as a result of COVID. So they're not having the severe reaction that some seniors seem to have had. And so we're having a lot of assisted living centers that have become positive in large degree that have then turned negative, and actually people getting antibody positive tests there, which showed they actually recovered from the illness. So that's sort of the good news, bad news of the senior centers. The senior centers, the long-term care facilities do need to be tested. At least those who have one positive tested person or not, and preferably all of them. But that's a good way of identifying people who, whether or not they're symptomatic, need to be watched more carefully than they would otherwise have been if they tested positive.
Okay, I want to go back to the test real quick. This is a question from Joe. He says, how long after exposure should you get tested? Is there an incubation period before testing?
2 to 14 days is the incubation period. So you can get tested anytime in between that. That's testing for the virus. The virus is the presence of the infectious agent. Antibody testing, you've got to wait until your symptoms are gone. And from what I've seen in terms of personal experience, the antibodies are well after 2 weeks of the virus. So you have to wait for it to be convalescent for probably a week or two after you get rid of your symptoms. That's for the antibody test. The viral test is is quicker.
Okay, here's another question on senior facilities from Holly. Can't the senior citizen facility simply operate as though everyone is infected? Wouldn't that be the safest?
Yeah, that's how a lot of them are with PPE. The problem has been that we haven't had enough PPE, PPE being personal protective equipment. And now that we have more of it, most of the nursing homes and assisted living homes are using that, but there's still not adequate amounts to wear it all the time and to change every single time you come across someone. So it's still important. That's an important point to make. And it's an important thing to try and do. Both people should be wearing masks, assuming that they don't have emphysema or other oxygen issues among the seniors, and very careful cleaning as well, and social distancing.
Okay. I know we can go over and over for all these, but we have about 9 more minutes. So I just wanted to ask some other kind of secondary questions. We asked last week Dr. Lebarsky about vaccine, timeline for that, and essentially a treatment for COVID-19 as well. So do you have any insight on that from the public health perspective, the vaccine and successful treatment for people who are tested positive?
Yeah, what's it called? Medemsvir? I should know what this is called. Anyway, there's an antiviral medication which I should remember. I'll remember in a few minutes. Remdesivir. That is fairly effective at reducing the length of the disease, may make a difference in mortality and death rate, but is not a game changer by any means. But there is something out there for that. That's an antiviral medication. The vaccine, which will take at least a year to come up with, because we want to make sure it's safe and effective. If you don't have a safe virus vaccine, it can cause a huge amount of problems. And obviously you want it to be effective to a certain degree at least. So it's a good year probably from now before it will be developed. There are all sorts of different types of vaccines that are being worked on. There's a lot of cross-pollination of people around the world, which is a nice thing for once, that they're working together on this. But it's going to be a huge issue because this is a novel virus, because it's a new virus that all human beings are seeing for the first time all over the world. There literally need to be close to 7 billion, that's the number of people in the world, 7 billion doses of vaccine that need to be available, or let's say 4 billion. And looking at how incredibly woefully inadequate our federal supply has been of simple things like swabs to get the vaccine bottles or vials, the syringes, just syringes, 4 billion syringes, and have them in the right places is going to be an issue. So getting the vaccine delivered is going to be an issue as well as developing the vaccine.
Okay, let's see. So this is a question about the testing again. Question from Haru is, antibody testing doesn't necessarily mean that you won't get it again, right?
That's correct. It's presumed that based on extrapolations from all other viruses, because virtually every other virus, when you have when you get antibodies developed to them after you've been infected, you have at least some immunity. The assumption is you probably have at least some immunity for at least some period of time. That's not very reassuring, but that's likely the case. We'll know more about in the next few months.
Yeah, and I know we're kind of bouncing around now. We had a little bit of order earlier, but I want to make sure we get some of these important questions that we missed the first time around. This is a question about testing. So right now, you can mainly get tested for, do you have it or you don't have it? The antibody is not readily available, verily, in some of these testing locations. It's, do you have COVID-19, yes or no? And so if you go get tested today and then, somehow you're exposed this weekend at some gathering or something like that, that test is a snapshot in time. So do we assume or do we recommend people get tested on a regular basis, on a weekly basis?
Very good question. Like the NFL or the NBA, I think, is doing something like that with their players to test them regularly. Honestly, it probably doesn't matter. It's partly because we don't have enough testing to be able to do that right now. But it's probably not necessary to do. More important to pay attention to symptoms. Although again, 30 to 40% of people don't have symptoms. But in general, that kind of testing probably does not need to be done very frequently.
Okay, I have some other broad questions that were sent in here earlier about parks and beaches. Do we really need to close those and have strict guidelines there? I will say the last week I was out on the American River, and I was a high school kid here in Sacramento once too, so I remember those graduation times. And there were probably about 100 kids gathered on a secluded spot. I was out on my paddleboard with my little daughter, and we saw probably 100 high school kids having just a massive party there, and they were all up in each other's space. So that obviously is not recommended, and I did see that, but I'm sure the majority of people are not doing that. So what's your perspective on our river, river access points in Sacramento, lakes and beaches and state parks and so forth?
So I'm a little bit more lenient. I think that boating and rafting are okay as long as you do not tie up with the people, right? Because when I drove over Interstate I-5 recently, on one side is Discovery Park with the beach where the American River hits the Sacramento River, and there's all these people gathered together because it's a hot day. And on the other side, there's a boat. There's like 25 boats all tied together with people socializing in between. That's obviously not a good thing to do. And we've got to, we've been relying on code enforcement to just encourage people to break apart, et cetera. But, please, if there's one message to get is that we need that the stay at home has worked. It has worked. We are very low rates of disease and deaths, and we want to keep it that way. And we want to be able to open soon. In order to be able to open soon, we can't have a ton of cases. Should I touch base on the flu thing real quickly? Because I saw a few questions on here that might be good. So one of the questions I get, I've done a bunch of these town halls, and one of the questions I get all the time is, well, what's going to happen when the flu season comes back in the late fall? Isn't it going to be like a double whammy, and how are we going to be able to tell the difference between the two? And for one thing, there is a flu test, so you can get tested for the flu. For the second, of course, there's a flu vaccine, which although it's certainly not 100% effective, it's usually about 50 to 60% effective at preventing the disease completely, but also it's very effective at decreasing the severity of the disease. So I think that we're going to get a lot more people testing for getting flu vaccine this year than usual, because they're going to be concerned about the combination of flu and coronavirus. And I would hope that when the coronavirus vaccine becomes available, people remember how severe this can be and that they get vaccinated as well.
Okay. Well, I think that gets to the majority of the general topic of the question. So I did want to ask a couple of questions, or address a couple of questions that people asked about me as the assembly member related to the overall impact on the economy and our state budget. I do chair the budget committee overseeing education funding in California. That's our public school system, from childcare and preschool programs to our K-12 public school programs to community colleges, UC and CSU. And it came out this week that the state budget is facing a $53 billion shortfall. That's B with a B, so that's a really big number. So this is essentially in the same magnitude what we saw in the Great Recession 10 years ago. Actually, it's worse in the steep decline over the short period of time, especially with the huge number of people not working or unemployed. So what does that mean? That means that it's going to be a difficult budget decision in a few weeks. We're going to have to look into our one-time monies we have set aside for a rainy day. It's clearly raining right now. So we have north of $20 billion we saved, which is really positive after the last recession, to prepare for just this. We have some money that we've gotten so far from the federal government, but it's like roughly about 20% of what we got during the last recession 10, 12 years ago. So there's an effort in Congress to do a second kind of stimulus or CARES bill to help states, schools, local governments. So we're hoping that we can significantly address that issue with more federal money. And then we're going to have to make tough decisions. In the last recession, we were able to borrow money, essentially do like a deficit bond. So we borrowed money and paid it back over a 10-year period to bridge the gap. We don't know how long it's going to go on for. Is this recovery? Is it a V-shaped? Is it a U-shaped? Or is it an L-shaped? It's going to take a period of time. So those are the issues that we're grappling with, and that's the big burden I'm focused with right now, overseeing this budget process in the Assembly. So I'm working on that as well. But today was really about our constituents, you all who are joining us today. Another hundreds of you participating today. Thank you so much. These are the questions that my neighbors ask me, my own family asks me, my kids. What's next? When do we get to go back to school? When do we get to go see our friends? Today, we went and drove by our girl's fifth grade teacher for Teacher Appreciation Day, and she was saying how much she missed the kids, and our kids were saying how much they missed her and their classmates. So, we're looking to move forward, but we also need to learn from lessons of the past and not be irresponsible and focus on protecting and saving lives. So, with that, thank you so much, Dr. Bielenson. I just want to say a fun note. Every time I talk to him, he's kind of going to be bashful here. But if anybody knows me, they know that the best TV show ever done in the history of TV is The Wire. The 5-season series on HBO about inner city in Baltimore. And Dr. Bielenson had a role in The Wire. He was the public health director there in Baltimore, and he had a brief participation point. So, fun fact, Dr. Bielenson, tell us about your Wire, your Wire relevance to what I'm talking about.
Oh, it's just been a very interesting experience in Baltimore. David Simon wrote The Wire. He wrote a foreword to my book on The Wire and its ties to urban issues, and it was a very interesting. I taught the class on Baltimore and The Wire for 9 years at Johns Hopkins, and it was great fun and obviously very much appreciated by the students, not because of me, but because of the topic.
Yeah, and tell us about the episode in season 3.
Oh, the episode in season 3, our mayor, the real mayor of Baltimore, played me as the health commissioner, talking about needle exchange and the importance thereof.
There you go. You've been a leader in public health in Sacramento and in Baltimore on HBO. So for those of you that love The Wire, you know about Dr. Bielenson. For those of you that don't know, I will say that President Obama has said that the best show ever done in the history of TV is The Wire. So there you go. Myself and President Obama both agree upon that. Anyway, thanks everybody for participating today. We appreciate this, and it's our goal to do this, once a week or so to talk about what's next for California. And I just wanted to leave on a lighter note there. But thank you everybody for engaging, and thank you for doing your part. By working together, we're going to get through this, and we're making Sacramento and California a healthier place. Thank you so much.
Thank you.
Thanks, Dr. Bielenson.
Thank you. Great.